All right. Hello, everyone, and welcome to our webinar today on rethinking note strategies for making documentation simple and meaningful. We have an absolutely wonderful speaker today. I'd like to give a big welcome to Dr. Melissa McCaffrey. She is a licensed clinical psychologist and self-proclaimed documentation diva. And she also struggles with ADHD, and she's going to talk to you a little bit about that today. But after working for mental health agencies for 8 years, she started her own company and she has been the owner of QA Prep for 8 years. And QA Prep was created to help therapists learn how to make documentation flow naturally, to decrease their workload, and to be confident in all their paperwork. And it is her passionate to help therapists create rock solid documentation so they can spend more time with their clients and less time worrying about that said paperwork. So thank you so much for joining us today, Dr. McCaffrey.
Thank you so much for having me. I'm really excited to be here and see everyone. So we are going to dive right in to talking about notes. We're going to talk a lot about making things simple, making it meaningful, and I want you all to feel really, really comfortable sharing and asking questions throughout today. That's going to be a big part of this, is not only me telling you kind of what to do or how to do something, but also truly problem solving through whatever questions you have. So I want to know, go ahead and put in the chat, what is your biggest struggle with writing notes? There are a lot of common ones that we hear, and I'm going to actually exit out of here and check out the chat and see what you all have to say. So go ahead and put in the chat, what is your biggest struggle with writing notes? Getting them done, time, doing treatment plans, finding the time to get them done, keeping it simple, keeping it current. Let's see, not giving too much word for word. A lot of things about time. So we're definitely going to talk about that. What do we put in them? What do we leave out? How to enter notes for couples. Yeah. Not specifically going to talk about couples, but we can absolutely answer questions related to that, and feel free to ask your questions, getting into more specific clients as well. Meeting insurance requirements, we're definitely going to talk about that. How to be succinct, how to sound clinical. Yeah, these are great. Wondering if they'll pass an audit. How do you develop a treatment plan on time? So yes, medical necessity, all of these things. These are great. How do you convert dialogue into clinical terms? Yes, because basically you are doing a bit of translation, right? You're doing a session and then you're turning it into a note. And so I'm going to give you some very specific and really simple strategies for doing that. That'll work really well with ICANN notes as well. Insurance audits. Yeah, awesome. Great. Thank you guys so much for sharing all of those. Very, very common struggle. And you could see a lot of themes in there were the same, talking about time, insurance. How do you, what do you actually put in the note? And we are going to talk about all of those things today. So one of the biggest things I hear is, I never got training on documentation, right? So if you think about it, when was the last time you had a training on documentation? So not how to use your EHR, but actually what do you put in the note? Most of us get little to no training in this, which is a little crazy. So we're going to do, I'm not going to read things to you the whole presentation, but we are going to do a quickie view of the ethics codes to see, okay, so maybe we never got training in documentation, but what do our ethics say about it? Like, what are we actually supposed to do? So APA, the American Psychological Association, says maintain, disseminate, store, retain, and dispose of records and data relating to their professional and scientific work in order to, basically, this is what's supposed to be in your notes, right? Facilitate provision of services later by either that therapist or other professionals, meet institutional requirements. So that'd be if you work in a group practice or at an agency, whatever those requirements are. Ensure accuracy of billing and payments, and ensure compliance with the law. And as you all know, every state you're in, every country you're in, the laws are different around what requirements there are. So that's what American Psychological Association says, which seems like a lot, but also doesn't give us much to go on, right? It's all those questions about what to put in the note are still relevant. So what does the American Counseling Association say? It says that notes should include sufficient and timely documentation, and that therapists should take reasonable steps to ensure that documentation accurately reflects client progress and services provided. So this is a little bit more where it specifically says our notes should have client progress and whatever service was provided in there. But again, how do we do that, right? So we'll look at one more, or we might have another one too. AAMFT, so the American Association of Marriage and Family Therapists. What do they say? Maintain accurate and adequate clinical and financial records in accordance with, again, applicable law. And that's it. That's all we have to go on. So it's really not much. So what ends up happening is that we have a lot of trial and error, right? So I've done this. Most of you have probably done this as well, where you just sit there and try to figure it out on your own. And you do different things, and maybe you get feedback from a colleague, and then you adjust how you're writing your notes. Or maybe you get feedback from a supervisor, or you get an audit, and then you adjust your notes based on that. But really, it is kind of this trial by fire. You're just kind of doing it and figuring it out as you go. So what I'm going to talk to you about today are some very specific strategies for how I was able to figure out paperwork success early on, and then ways that I have helped other therapists continue to do that now. So when I was a therapist, I was not working late nights, I was not working from home, and I actually got consistent and positive feedback on my paperwork. And this is even, as a baby therapist, when I was doing that. But it was a lot of that trial and error and figuring things out on my own. And I'll go ahead and skip down to that last point there. If you're familiar with the Myers-Briggs, I identify as an ENFP, but I definitely have ADHD. So I want you to know I am not a naturally super organized person. That all this paperwork stuff is not a natural strength of mine. That is not why I got into this. And so if you are someone who really struggles with writing notes, with doing treatment plans, with paperwork in general, I feel you. And I have been there too. And I've been able to figure it out. And so that is why a lot of my strategies are a little bit different than other things you might have heard before. And I typically come with more than one option for you, because I know that what works for me may not work for you, and what worked for your supervisor may not work for you, and what works for you may not work for someone else. So we're going to talk about all of that today. And I also want you to feel free asking questions throughout today's presentation. You can put them in the chat. You can use them in the Q&A section as well. If you use the Q&A section, it's a little easier to highlight your questions. But we will be stopping and going through questions to really work through all of these things throughout the presentation. So we will not wait until the end to answer questions. We'll stop about every 15 minutes or so and go through your questions there. So all the other credibility stuff, psychologists, I was the HIPAA compliance officer at some point at an agency, all of that stuff. But really the big thing is I've had to figure this out, and I work with hundreds of therapists on how they can figure out their paperwork as well. And so that is what we're going to be doing today. Real quick, what we're going to be doing is going through the most common mistakes that I see in documentation. We will talk about at least 3 strategies for creating high quality notes. And we're going to talk about how to save time on notes without having a negative impact on your clinical quality. So this addresses a lot of what you were talking about in the chat earlier on. Now, I will say this does require a bit of a paradigm shift, right? So at least for the next, 80 minutes or so, we all kind of want to agree that we're not going to look at paperwork as punishment, right? So paperwork is not punishment. And instead, we're going to look at paperwork and note writing as a powerful tool for yourself and for your clients. So I want you to consider, what if having good, meaningful notes could actually transform your relationship with your clients? And what if writing good notes could make you a better therapist? This is something that I do believe, and I hear from a lot of therapists that they feel really confident in the clinical work they do and don't feel confident in writing notes. And that lack of confidence does start to bleed into other areas and start to impact them. So I want you to feel good at all aspects of your job. And writing notes, unfortunately, will always be a part of the work that we do as therapists. So we want to feel good about all of that. So remember that paradigm shift today as we go through all of the things that we'll be going through. So we'll start off with this quote by Rhonda Sutton. She says, "A good set of progress notes is like a map for the counseling professional, a map that reveals roadblocks to progress and discloses the direction in which therapy is going." So I think if you've had periods of time where maybe you did feel more confident in your notes or where you're really up on getting them done on time, most of us do feel this, right? We feel like this is good, like we're on top of stuff. I feel like if anyone needed to see what was going on with my therapy with this client, I could easily show them because my notes are on point, my notes are on time. And I think we all know in the back of our minds, as much as we may, not like notes and maybe talk negatively about notes, we do know that when we have them all set up well, it feels really, really good. And guaranteed there are people on this webinar who have never experienced that feeling. So you're not alone if you haven't experienced that feeling yet, but you can get there. I also want to highlight some resources. So we have a handout, and in the handout you'll see there's going to be a therapy interventions list. So I know within ICANN Notes you already have a list of interventions, and so my list is definitely more detailed, and it's not meant to be comprehensive in that, copy all of those interventions and put them in your own template. It's meant to be an additional resource so that you can pick and choose how you want to edit your template, and we'll talk more about that. There's a progress notes checklist, which is meant for you to be able to review your own notes. So you want to be able to self-audit and see, okay, am I covering the main points? There's a suggested progress note template, which we're going to go through as well, using the options that you have available in ICANN Notes. Because there are so many, my recommendation is to pick and choose which ones you're going to use, and then just consistently use that same format over and again. We also have a sample progress note and some note writing prompts. So we'll talk about all of those things. All right, so we are going to dive into common mistakes in documentation. And like I said, feel free to ask your questions as we're going, and we will stop after we go through this section and actually answer them. All right, so first one, and I think we had people in the chat saying, yeah, I worry about how much do I put in? Is it too much? Is it too little? So the first mistake people do is they write too much. And so that can look like adding unnecessary details. And this is really easy to do. So this can be what I see as the hangup when you're using a system like ICANN Notes that makes writing notes a lot more easy and simple. Is then people will sometimes overdo it and you just start clicking and adding all this stuff into your note, right? So just because it's easy doesn't mean that's necessarily what we want to see in the finished progress note. So the finished progress note, we really want to just be focused on the essential details of that session, and it doesn't need to have a bunch of fluff in there, right? So we want to cut out all the fluff and just stick with what's important. And that makes it really difficult. If you've ever done that, and I think a lot of us probably have, right? You just kind of start clicking and adding things in and or writing more and more. And then you realize when you go to look at the note later, it's really difficult to look through. And I can tell you as someone who has, had a job being the auditor for different entities, right? And coming in and looking for notes, the more I have to sift through a bunch of text and read through all of that in order to find what I'm actually looking for, then the more I'm just going to keep sifting through and reading through more of the notes. And the more I read through everything in detail, the more likely I am to find something that I can question. So you really want your notes to be fairly succinct, and you want You never want someone having to read through a big old paragraph of text. And especially with using an electronic health record, part of the benefit is that it's very easy to section things out, and we're gonna talk about how you can do that specifically in ICANN notes actually in just a few minutes here. But that's the thing. Don't feel like there's no point in making your notes seem long just to make it seem long. Long is not better when it comes to notes, for sure. And then spending too much time on notes. So anytime you do that, when you're writing too much, whether it's you're typing in your own details or clicking through a bunch of different options and sections, it ends up taking up a lot of your time. And I know a lot of people had mentioned that in the chat at the beginning too, that it can take a lot of time to write notes. You want notes to feel like a pretty easy task and a quick task, because something that you know you can get done in about 5 minutes, you are much more likely to do and to do earlier on. Whereas if it feels like it takes you 20 minutes to write a note, and I'm sure there are people on here who are spending that much time or more writing notes, then it becomes something you avoid, right? First, it becomes something you dread, then it starts to become something you avoid, and then it's something that becomes this monumental task, because not only does it take you 20, 30 minutes to write a note, but you're also backlogged with a bunch of other notes because you've been avoiding the task. So here's an example of a note that is too long. And you can see it looks on, if we just look at surface level and don't read through it yet, we're like, oh, well, this, that looks like a good note. And so here's one of the mistakes that I see a lot of therapists make, is they just think that their notes have to sound clinical, right? So it's like, oh, I need to make them sound smart or sound clinical or complex in some way. And that absolutely was not a requirement in any of those ethics codes we read through, right? And that's guaranteed not going to be a requirement in any of the state laws. What's most important is that your notes are readable, that most people could easily read the note and understand what happened. So maybe not everyone would understand specifically like the interventions, because those are more clinical, but pretty much all the rest of these sections, any layperson should be able to read and understand what happened. So I want to take the pressure off of trying to make your notes sound clinical, because that is not something in all the rubrics I used for Medicare, for Medicaid, for private insurance. Having your notes sound clinical was never anywhere in that criteria. It was more important that I understood what happened. So I just know that that's one of the things that can tend to lead to notes being too long. So here, part of the thing is that we just have so many sections that are overlapping, right? So we want to make sure anytime we write something, we don't need to write it again. It doesn't need to be in another section. Also, things like mental status exam. Here, this is pretty much a full mental status exam. Now, something like ICANN Notes makes a mental status exam really easy, because you can just kind of click, 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 which is what I did in this note. You'll see it's pretty much, this entire thing could be summed up by saying all within normal limits, right? So this entire paragraph could literally just say all within normal limits. So there's no reason to have this entire text here. And personally, I don't believe you need to do a full mental status exam for every client for every session. If you are the typical therapist seeing clients for outpatient treatment, right? Mental status exams were meant more for psychiatric hospital settings, intensive settings, clients who are in a more acute state. So that's the time to reserve for that. I will go through how you can use the mental status exam section and actually make it meaningful to what you're doing. Because that's one of the things, right? So we have part of this whole presentation is making your notes meaningful. This is not meaningful to anyone reading this note, right? So just clicking and throwing information in a note doesn't make it meaningful or useful for you or anyone else. So that was one of the things I really wanted to highlight there. Whereas look down here at current stressors. This actually is super easy to read, and it's a nice descriptor here. Like, I know exactly what I'm looking for. If I'm an auditor, I'm going to go straight to this section. I'm going to go to this section. I'm going to go here. I'm going to look at interventions. And then I'll probably pick one of these sections up here. But a lot of this stuff you don't, just because you have an option to use it doesn't mean you have to. So that's one of the things I want to really hit home today, is thinking through what sections do I use of my note template, and are they the ones that I find useful and are meaningful to me. Okay, so on the flip side is writing too little. So I do see both, right? I see people who have paragraphs and paragraphs of text, and then I see people who have almost nothing. So what leads to this is typically, this is where I'll hear from therapists, well, I don't want to write too much, or I don't want to write too many details, or I want to keep my notes vague because what if my notes ever end up in court, right? This is one of the most common things that I hear from people. So first, I want to dispel a few myths about this. I have quite a few attorneys in my family and some as friends as well. And guess what? If anyone has a really good attorney, then an attorney is going to use those notes however they want. A really good attorney can flip them one way and flip them another. So it is not your job to worry about what is going to happen as a result of your notes ending up in court. Your job is to write what happened in your session. I'm not saying that nothing bad could ever happen because of notes being read in court. However, for one, it's extremely rare. Like, it's the amount of fear I see with this and the amount of people who talk to me about it versus the amount of time it actually occurs. I mean, it's just a huge, huge discrepancy, right? So for one, it's so unlikely to happen to most of you. But also, it flips the focus of what our notes are supposed to be on, right? So the purpose of our notes, if we look at those ethics codes and if we look at in practice, in reality, what do you use your notes for? They're helpful to go back and review progress for clients. They're helpful for insurance, right? For showing insurance what you've done if there is an audit. Those are the more practical reasons you're actually going to use your notes. So I want to take away a little bit of that fear of having your notes read in court. Also, if we make them more succinct, if we make them fairly easy to understand, easy to read, and we're taking a lot of the subjectivity out of notes, then having them read in court, then you can feel like I presented a good product. I presented a factual account of what happened in this therapy session. And so there's no pressure on you to do anything else or make anything else happen. Another thing that happens when you're writing too little is your notes are no longer serving you, right? So a lot of people who are writing too little, it could be because of, again, the fear of court, or also just, I hate writing notes. I don't know what I'm going to do with notes. I just avoid it altogether. So I'm just like writing in a couple things and moving on. But notes actually can be really helpful. And we want to make sure that our notes are useful for us. I know I had a client one time who was very, very, very depressed when they came to see me, and about like kind of on the brink of feeling suicidal, kind of some passive suicidal ideation in the beginning. And then about 3 months into therapy, they told me they were feeling really hopeless because it feels like, therapy's not working because they're not better yet. And we all know if someone is severely depressed 3 months in, they're probably still going to be depressed, right? Ideally, they are starting to feel better or seeing some progress, but it's rare that depression is just like cured 3 months later. So one of the things that was super helpful was I went through that client's notes and was able to highlight for them, this is what you said to me, the first session, the second session. This is what we were working on the first or second session. And look, we actually have made some pretty good progress. And it ended up being a big turning point in therapy with that client because they were able to then see that, and it really helped motivate them to continue at a point when they felt like quitting. And I will also say it helped me. It helped boost my confidence a little bit because I was able to look through and say, oh yeah, like we really have done some good work together. And it can be difficult in those moments where a client is feeling like things aren't working, they're feeling hopeless. A lot of times we can take a little bit of that on, or we can start to feel like, am I actually doing good work with this person? So having your notes factually show like what has happened and what you've been doing can be a huge encouragement, actually. But if you're writing too little, you won't have that information to share with your client or to even give you yourself that insight and that boost. And so basically your notes are not serving you or the client. Okay, so here's an example of a too short note. So this would just be 5th session with client, discuss feelings related to dating and identity, assign journaling exercise for the next week. Because again, if this is the same note we see every single week, it's just not giving us anything to go on, right? On top of the fact that this would also not meet criteria for insurance companies. Any insurance company would be able to kind of pick apart this note pretty easily. But insurance aside, because we will talk about insurance, but I also want to highlight that your notes are important without insurance companies. This just wouldn't be that helpful for anyone later on. Okay, so here's an example of a just right note. So in the note template suggestion that I have in your handout, for most of you, I would recommend you're seeing clients weekly for therapy, it's typical outpatient setting. I would kind of pick these 6 sections to be your consistent note template. So one of the things you'll want to do, and this is where, a lot of people sign up for an EHR and then say like, oh, I never spend the time to go through it, right? And actually upload my forms or do all the things that make it useful for me. This is one of the best ways to make your electronic health record useful for you. Go through and identify for yourself which of these sections am I going to use consistently and every time. And if you don't pick these 6, pick another set that work well for you. I will highlight which ones I think work best for insurance, etc. But just because it's all there doesn't mean you have to use all those sections. And it's much easier once you just decide for yourself, I'm going to use, boom, 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 these sections. And then every time you go in to write a note, you're doing it the same way. And so your brain will start to think of the sessions in these terms, and you'll start to kind of train yourself in how to write it, and it will become much easier because you'll go in and be used to doing this. And that way, every time you're not questioning which one do I pick, what do I put where. So for here, we have verbal content of the session. This is kind of, I'm thinking of it as kind of like topics discussed, right? So spoke of family problems in today's session, work problems were topic discussed, discuss communication skills. So these are using the template that's already available inside ICANN Notes. So I didn't even add these in here. It's just, here are the topics that we discussed. So I was able to just click on here and then click boom, 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 those 3 areas. Very, very quick and easy. I did add, and this is something to consider. So if you've ever thought like, what if I have a client quote? Like, where do I put that? I would just stick it in this verbal content of session. You can always write anything into the note, and recognize need for communication skills, specifically around family conflict. So that was kind of their insight, right? I do think that can be a helpful thing to consider in each session. What was a good client quote, or what was kind of an insight they had this week? Interventions. So here's where one of the handouts is an interventions list. And I would recommend go through that and add in interventions that you like to use a lot into your own note. Add other interventions that you use. If you use a specific modality like EMDR or EFT, go in and add all of those interventions into that note so that you can easily then click. One of the things that I do is I will basically add the intervention like in this way, explored feelings related to, and then I just type in right here, relationship with father, right? So that way I'm not having to type a full sentence, or I'm not typing much, but I also feel like I can make my list fairly easy and simple and not have to be too many things in a drop-down menu or in a list of things to select, and then just boom, write that in. Discuss concept of, aggressive, passive, and assertive communication styles. So here's an example where in your interventions, you could add discussed concept of and then leave it blank, and that way you can just type it or discuss that. Or you could add this whole thing as an intervention if it's something that you commonly do with people. So anything that you know you commonly do, whether it's a book you often provide that you think is helpful for a lot of people to read, a certain intervention or modality. Like if you pretty much talk to all of your clients about mindfulness or teach all of your clients how to use mindful meditation, for example, add that in, and then you're not even typing, you're just adding that into your interventions list. Behavior, and here I just added this, client improvement, recognizing and acknowledging needs and how to work with them in collaboration. Mental status, so here I just chose a couple of sections. So again, just because there's a whole mental status there doesn't mean you have to use every section in the mental status exam. What are things that we're typically looking at? So again, if we think of a weekly therapy client, what am I really tracking? Mood, affect, behavior, maybe attention, right? Those are pretty much the only things that I'm actually tracking that are valuable to look at in each individual session. And it's totally okay to just focus on those areas and only add in what seems to be relevant. Level of care justification. So here is where it's real. This is kind of like your medical necessity section. So if you work with insurance, you do want to address medical necessity in every single progress note. Okay, so you're addressing, well, I'll stop. I won't go into too much detail because we are going to talk about that more specifically later. But you want to make sure that you have a section in mind every time that I always put my medical necessity component into this one section. So again, you're never having to think about it, right? And here I can just make it pretty easy because, you know, they already have a lot of this written out. And so it's very simple to just pick kind of what is the area of life in which this person continues to need help. And then instructions, recommendations, plan. Here I think it's really helpful. So a lot of people ask me, and I've actually only started to create these kind of recently. You can imagine I create kind of templated statements and handouts on things. And I do want to have some like plan statements because you want to have something that's going to happen, because we all know if all your client does is show up one week and spend that 50 minutes with you in therapy and then literally does nothing, thinks nothing about therapy, absolutely no attempt to work on anything at all until the next session, like not much is going to happen, right? So we know that we have something in mind to happen in between sessions. So one of the things I did was, you know, I created like 3 different types of statements that say something very similar. And then you can just click on that button in ICANN Notes, and it'll pick one of those statements that's basically saying the client's going to work on stuff that you learned in session over the next week, right? So that way it'll pick which one of those you want to have. But that's an easy way. Again, it takes maybe 5 minutes to set that up, maybe 10 minutes if you want to sit there and think about it and give yourself some more options. But then literally it's going to take you 1 second to complete that part of the note ongoing. And here you would also add, you know, anything else, like if you did recommend a book or made a referral or something like that. Excuse me. Okay. So this is just right because, again, it's easy to read, right? It's sectioned out, and each of these are just boom, 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 very easy to see. And we don't have a giant mental status we're having to sift through, and the level of care is easily identified. Okay, so now let's talk about insurance stuff. So another mistake I see is over focusing on insurance, right? So instead of thinking about how can my notes actually be helpful to me, how can I use them to help my clients, all we think about is what is insurance going to see? So this leads to not personalizing documentation, just kind of using these blanket statements for everyone all the time, and spending too much time on documentation. So a lot of therapists are sitting there so worried about this medical necessity statement and how do I include this and did I include the right thing? And I wouldn't want anyone to spend all their time writing their notes just thinking about insurance companies, because that's not why we're here, right? Yes, it's important to do. Yes, I value it and think we need to consider it. And our notes are so much more than that. And really what ends up happening is insurance companies and the mandates around documentation end up impacting our own self-care and our own job satisfaction, right? So I can't tell you how many times I've seen people say that. I can't tell you how many people I've talked to literally just last week who told me, I'm seriously considering letting my license go and just doing coaching because I don't want to have to worry about notes. That's the only reason. They're like, I don't want to have to worry about documentation. Or how many people will say, I don't know if I can do this because insurance only pays me so much and I have to spend so much time on my documentation because of insurance. And these are the sad realities that I see from sitting here and overanalyzing your notes all the time. So we want you to be able to just use that medical necessity statement, that justification for level of care section, and click and feel confident that you've met insurance requirements and not sit there doubting yourself. Now, the flip side to this, another common mistake I see, is forgetting to include insurance altogether. So this is overarching, not just related to the notes, but what happens when people do this is they're just kind of viewing the diagnosis as arbitrary. So it's just like, well, I just have to pick a diagnosis to put in the note somewhere or to put in the file somewhere so this person can use their insurance. And that's a huge red flag to insurance companies and can be a big, big problem for people if there is an audit. So you do want to actually consider the diagnosis and look at that. It is a very important component of any type of audit is what the actual diagnosis is. So, use your DSM and provide an accurate diagnosis. And then if you're not thinking about insurance and not worried about medical necessity, this is where I hear from people a lot when they say, well, I give clients a super bill. I don't deal with insurance. I'm not contracted with insurance. I give them a super bill. If a client is using their insurance company to pay for therapy, so if they are submitting those super bills to their insurance company and getting reimbursed, even on their own, you are not dealing with it at all, that insurance company can still ask for records, right? They can still audit a file because they're paying. And that's an agreement that you're not a part of, but that the client and the insurance company have agreed for, right? The client has said, yes, I want you to pay for this service that I'm getting. And so I agree to whatever terms. Your client may not know that, right? Most clients aren't aware of that. So that's where it's important for us to inform them. As soon as someone asks you for a super bill or talks to you about getting reimbursed, the first thing you want to say is, something like, of course, whatever your policies are, it's not a requirement that you have to do it, but most people will. Sure, I'm happy to give you a super bill. I also want you to know that, if I give you a super bill, that means that I do have to include a mental health diagnosis on that form, and your insurance company could potentially audit your mental health records at any point if they're paying. So it is important to let clients know that and make sure they're aware, not to sway them either way, but just so that they're informed, because you don't want people to be surprised if they do get an audit or all of a sudden, now their insurance company is not going to reimburse for something and it has to do with reviewing records. So if you're giving super bills, you want to include that medical necessity part in every single note, meaning you want to highlight that the client continues to need therapy. And I'm going to show you like literally a way to do it in one sentence. Another thing, and I'll probably get a lot of questions about this and we can talk about them, but we're not going to go super, super in depth, is if you're doing couples therapy and billing insurance. So insurance companies only see individuals as being covered, right? Yes, you can do couples therapy. Yes, you can do family therapy and bill to insurance. And there is still one client, always. One client that you are billing to for that insurance company. And so all of the treatment really needs to be focused on how that one client is getting their mental health disorder and their impairments addressed through the method of couples or family therapy. I say couples is just much more common. So it is perfectly fine to do that, but it gets a little tricky. And so you want to be careful if you are billing a lot of couples therapy to insurance. And again, make sure your clients are aware of the parameters around that. So, it will be one person will have a mental health diagnosis. So we can get a little bit more into that if people have more specific questions, but the big thing there is remembering that to an insurance company, it's, person A in the couple has a major depressive disorder, and the couples therapy is treating that specific major depressive disorder for person A. And so it's not focused on both person A and B or on person B. It's focused on how the couples therapy is actually helping treat that individual. So that's the thing to keep in mind when writing notes for insurance. Okay, so I said I would give you a little statement. So anytime you're thinking about insurance, you want to think of these two things as your new best friends, okay? They are inseparable when we think about insurance. It's progress and need, and they go together always. So we're always showing insurance that, yes, therapy is working. So please keep paying for therapy because it's working. And this client still needs help, still has some functional impairments. If you don't like that phrase, this client still has some challenges, right? There's a reason they're in therapy to see you. There's some things they want to improve. So we want to show insurance, yes, it's working, and we still need more, right? So keep paying because it's working, and keep paying because we still need to have more work to do. That's the one thing you need to keep in mind for progress notes around medical necessity. It doesn't mean you have to make up progress or anything like that every week. So I get questions on that a lot. It is perfectly okay to say the client made no progress this week. You just wouldn't want to say that for 10 weeks in a row, right? So you wouldn't want to show like for 10 weeks in a row, this client made absolutely no progress, but keep doing it. Because then it's like, well, that's not working. Obviously, this client needs something different. You also wouldn't want to show for 10 weeks in a row, like we're making so much progress. This is great. They don't need any help anymore. Again, okay to say that, 1 week off. It's okay to show that therapy is not linear, right? It goes in stages, and that's fine. But again, for 10 weeks in a row saying basically they don't really need therapy anymore, but they just kind of like still coming, then insurance is not going to pay for that either. So one easy way you can write that, and if you wanted to break this down to easily use like in ICANN notes, you could make this 2 separate sentences, right? So client has made progress in, and then whatever is their progress, but continues to show impairment in, whatever they show impairment in. So you're highlighting both of these things. Literally, this is one sentence that shows that. So like I said, you could make it into 2 sentences. Client has made progress in, period. Client continues to show impairment in, period, whatever that is. But this is a quick and easy way. And yes, you can, as you learn these strategies, or if you go back through other notes, or if you've been writing notes for a while, then you could probably also even just make a bunch of templated statements of client has made progress in improving anxiety, in socializing more often, in communicating with their partner without becoming dysregulated. You can kind of have these common things that your clients work on and have those be consistent statements. But here's kind of your starter statement. All right, so let's take a break for some notes. I'm going to check the time here. Or not for notes, for questions. So October, do we have questions so far?
We do. We have quite a few actually. So this is great. So one is from Adrian. Do we need to add how the client responded to the intervention?
Not necessarily. So you could have, as long as you have kind of in general what the topics were discussed. And like in my example note, I had the client insight in there, that can be sufficient. But that is a common thing that people might have experienced in trainings. Like when I was in an agency, that was how I was taught to do notes, was basically I do an intervention and then write the client's response to the intervention. It's one of those things that's not wrong to do. And if any strategies I say, if you're already doing something else and it works really well for you, just keep doing that. Right? So don't let me overcomplicate it for you. What I'm trying to do is simplify it for you.
Great, great. And then we have one from Jennifer. Are the notes supposed to reflect the goals, and should we place the goal we are working on?
So my opinion is that the notes do not necessarily have to have the goal in there. However, overall, your notes should support the goals. So again, therapy is not linear. It doesn't mean that every single week clients come in and you're always talking about this one thing. However, you want to write goals that are generic enough that it will cover a lot of what you will likely talk about with this client. So for example, one, and I don't have anything on goals in here, so I'll just give you a quick tip. One quick and easy thing to do is have one goal on decreasing whatever symptoms they have and one goal on increasing some type of coping skill. If you have those two goals for every client, you'll pretty much be covering the goal, like a goal in every session you do. When you start making them super specific, that's when it gets difficult to track goals, to know what the goals are, to remember them, and then to tie every note into the goals. So yes, you want those goals to, or you want those individual weekly notes to show that you're following your treatment plan, basically, right? But it's okay to go off of a goal every once in a while. If you're never talking about the goals as part of the treatment plan, then those goals, or as part of the notes, then those goals probably aren't relevant to the work you're actually doing with the person. So that's something else. That's a time to just go back and change the treatment plan and make the treatment plan relevant to the actual work you're doing.
Right. Getting some positive feedback on that, so that's great. That's
Cool.
really good. Krista said, does insurance require mental status exams for psychotherapy progress notes?
Nope, they do not.
Right.
They just want to see that progress and need.
Great. And then I have a couple from Elizabeth. Elizabeth asked, is there a published taxonomy of interventions or website for the same?
Not that I know of, but in the handouts, you do have an interventions list that I created. And I will say, like, you could go, and this is another thing I'll see people do, where you start to get kind of anxious about your notes and like, am I supporting what I'm doing? Am I justifying what I'm doing? And I think a lot of that comes from, I'm not saying this about this specific person, but I see a lot of it comes from, feeling really insecure about like, am I doing this the right way? I've never been trained in how to do notes. Are my notes good enough? And so then it turns into wanting to make my notes sound like really good and having this robust list of interventions. And what's more important is, again, to make your notes really understandable. And so I recommend just pick like 15 or so interventions that you have in your template for you to use consistently. Don't worry about having a huge list. Like spend some time looking through that list that I have, which is more comprehensive, looking through maybe other lists you have or resources you found. But then just pick like 15 of those and use those consistently. You don't need a huge list of interventions. It'll just make things more stressful.
That's great. And then Elizabeth also asked, how much does an intervention need to be described? If I have a 6-module treatment for test anxiety, and she's just using that as an example,
Mm-hmm.
do I need to describe the modules?
No, you do not. So you could say that you're going through, like for example, I'm going through module 5, and then whatever it's called, like whatever kind of title you have, I wouldn't just say module 5. I would say, module 5 of like whatever the method is. So I see a lot of people do this. Like, I think I'm not trained in couples therapy, but I think EFT has like different stages and things like that. And so usually therapists want to put those stages in there, for example, right? So they don't put just like the number of the stage, but they would put like the title of it, so that it would say. And then a way to kind of support that, this is where we're focused on notes today, but really it is part of an overall chart or file, right? Is that in your treatment plan, you would say, I'm going to use this six module system of whatever, and you would describe it in your treatment plan. So then it's all very consistent that you're following that treatment plan.
Great. And I have a couple more questions that have come in. So, but
Yeah.
I have had two people ask if you would repeat the two goal statement.
Oh, yes. So for goals, a quick and easy way to do it is one goal on decreasing symptoms. So decrease, client will increase depressive symptoms, and then give an example of that particular individual's depressive symptoms, right? Because it looks different for everyone. Client will decrease anxiety symptoms. Client will decrease ADHD symptoms. So very, very easy to do, right? We can all do that. And yes, you can turn that into if we want to make it a SMART goal, which is important for Medicare or Medicaid to have SMART goals. Then that would be something like client will decrease depressive symptoms. For example, insomnia, depressed mood, lack of motivation, lack of concentration, from 6 times a day to 2 times a day. Yes, it sounds silly to write the goal like that, but that's how you write a SMART goal. And that is what Medicare or Medicaid wants to see. I wouldn't worry too much about making your goals specifically in a SMART format if you're not working with Medicare or Medicaid. You can ignore that part if you don't have that contingency. So that would be goal number 1, decrease symptoms of, right? Goal number 2, increase whatever type of coping skill. Increase communication skills, increase social skills, increase socializing, right? If it's someone who's kind of isolating themselves, whatever it is that you're trying to increase. Because most of us, when you're working with a client, you are kind of formulating a treatment plan, it's pretty easy to fill those 2 buckets, right? We have an idea of what we want them to stop experiencing, and we have an idea of what we want them to start experiencing. And so really with those 2 goals, you should cover most of what you do.
That's great. All right. And then the next one, I think this is from Elizabeth. If you specialize, does the impairment need to be more specifically or deeply described? And she follows up with, do we need to provide evidence or quantify like a rating scale plus patient compliance and external rating, like a
Yeah.
teacher, a partner? So there's a lot in
Yeah.
there, but I can reread.
Yeah. So I would focus on adding that level of detail at the beginning. So in your intake note, you want that level of detail. You want to have a really good idea of how this person is impacted, right? And in their life, regardless of insurance, you want that. You want to know what this person wants to get out of therapy, and how are they experiencing life right now. With insurance, you want that, and you want to provide clear examples of how. But once you explain that in your intake, you don't need to explain that again. Now you're talking about how they've been impacted this week, right? So you're just focused on what happened that week. So most of my answers to most of my questions are it depends, and I give you options, right? One of the only black and white rules I have is never write anything twice. There's no point. You don't need to do it. Most of us had to do this in agencies. Sometimes I still go to the doctor's office and have to write my name 5 times, and it drives me nuts, right? This is the whole point of having an electronic health record, is that it will populate things for you. You don't have to write all of the silly demographic stuff over and over. And if you already have all the level of detail in your intake or in your treatment plan or somewhere, you don't need to then write it again every single time, right? Anytime if you're having a serious audit, what they do is they look at the intake first, and they're going to look at your file in chronological order, and they're going to read through, okay, did they justify the diagnosis? Is it clear there's a diagnosis? What are the symptoms? How is this person impaired? What is it impacting in their life? Then they're going to look at the treatment plan. Does that make sense with it? And then they're going to read your notes to see if you're following the treatment plan. So they're not reading your individual notes to justify like why they have a diagnosis or anything like that. They're looking at your notes to look at how treatment is going. So that's what you want to focus on. How is this is this person impaired this week? How did this impact this person this week? Do we
That's
have,
great information.
yeah, do we have a few more?
Yes, we do.
Okay.
We do. So,
Maybe let's do 2 more, and then I'll go through the next section just to make sure we get through everything too.
okay, absolutely. So, Ivy said, can you specify the same treatment plan and medical necessity for each note written on a client?
The treatment plan, so can you? Is that more like a logistical question?
I think she said yes. Yes. I believe that's what it is. Can you specify the same treatment plan and medical necessity for each note written on a client? And Ivy, you can clarify. Please feel free to clarify in the chat.
Yeah, I would say, yeah, treatment plan, just inherent in a treatment plan is that it should be covering every note, so you shouldn't need to do that. But yes, you do need to justify medical necessity, and that's that progress statement that we reviewed.
And then the next one is from Miss Raymond. Could you give an example of what to say in a couples therapy progress note? I would truly appreciate it.
Yeah, so I think the only difference with a couples therapy progress note or a family therapy progress note is that you do also want to highlight the interaction that occurred, right? So everything else is still very similar. You want to report what you did, your interventions, the topics were discussed, right? Like the verbal content. You want to talk about if medical necessity isn't a component, is a component. You want to talk about that. And then really the difference would be you're maybe saying how 2 people presented themselves, right? So maybe one person was angry, one person was tearful. And then you're talking about the interaction. And so if I were doing a couples therapy note, I would probably put it in that verbal content section. And maybe just even, again, you can make some cheat sheets, some little, some parts to include in your template that have interaction included. And have some ways in which that you describe how they interacted with one another. I think that's the key component that you don't need to even consider in individual therapy. That's really the only change. They don't need to be drastically different. All right. Okay, so let's keep going then, so we can make sure we give you some time management strategies along with the high quality notes, because I know a lot of people talked about finding time. So use a personalized and consistent template. We've already talked about this a lot. Use your own notes to create checkboxes, create that cheat sheet for yourself, add those interventions into your template. And it's super easy. While you're writing your note in ICANN Notes, you can click on that edit mode and add it in right away. So it's so easy to do. And that's a nice way to personalize your template and make it even better without feeling overwhelmed by doing that. It's not like you have to go in and do it all at once and it has to be perfect. When you find yourself, anytime you find yourself adding something in or writing something in or wishing something was there that's not, add it to your template, add it to your list, because that means that you'll probably want to keep using it. And so you want it to be quick and easy and just be able to click. And revise it when it's not working for you. So maybe you try using that suggested template I have, where I picked out those 6 sections to use. And then maybe you don't like it, and that's okay. Just because I recommended it doesn't mean it's going to work for you all the time, right? What I would say when you're working on your template, when you're because there's some therapists where it's like the last 5 years, it's like every couple months they're changing what they do and how they write in their template and adding in different phrases and all this stuff. And that can get overwhelming and also become kind of like a procrastination technique. So I would say when you make changes to your template or when you choose different sections you're going to start using, do it that same way for a couple weeks and let yourself get used to it. And again, kind of train your brain to start thinking that way when writing the notes. And then you'll have a better idea of what might be lacking for you that you want to include, or what doesn't feel as helpful that you're like, oh, maybe I don't even need this one section. That's okay. So this is kind of like you have a much broader list in the handouts of interventions but this is how I do my interventions to make it really easy. Now, again, when you have something like ICANN Notes, you can make it even easier. So assisted client and identifying, like this would be the cheat sheet that you would click, and then all you'd have to type in is what you identified. Demonstrate it. But if you, again, like I said, if you have specific things that you consistently use with clients, right? So for a lot of people, a lot of therapists use deep breathing, for example, with clients and teach people how to do deep breathing. Well, why not have this be demonstrated deep breathing technique, right? And then you can also have demonstrated by itself as an option so that you can type in other things you might do. But things you know you do all the time, add it in there. Make it a check, like make it an easy click for yourself. Identified coping strategies, explored feelings related to. So I have this like on my cheat sheet, like in the templates that I use with therapists, I have this like explored feelings related to family, explored feelings related to romantic relationship, explored feelings related to parenting, explored feelings related to family of origin, right? So you can add in a bunch of those so that literally you're just clicking on things and it's easy for you. But again, don't give yourself like a list of 50 things because then it gets overwhelming. You want to try to keep it in a good range. So that's where if you think it would be helpful, like reframed for client, that's probably something that's more helpful to set up in this way. Reframe for client, and then you just type in what they did. So again, it's very quick and easy. You're not worrying about writing full sentences and structure, like grammar and sentence structure and all of that. You're just typing in what you did. And you'll see like on that list I have, for example, explored feelings and processed feelings. I mean, we could debate about that, but it's probably pretty much the same thing. It's just a different way to say it, right? So just kind of pick one of those and you don't need to have both of them in there. So look through things that may be duplicates that you have that you don't need. All right, so you want to consider the meaning for all potential readers. We already kind of talked about this, so I'm not going to harp on this too much, but really, who's potentially going to read a record? Your own clients, potentially an attorney, usually not in court. Even if they do subpoena your records, it's typically them just gathering data to see what happened, to see if anything in there is even useful for them. That's, I mean, 9 times out of 10, when you get a subpoena, that's what it's for. Or what another therapist wants to see, right? So if you're transferring a client to a different therapist and they want to continue treatment. The one that we think about the least, that's probably the biggest impact, is what a client is going to see, right? So clients, when they ask for their records, they can see their notes. Clients have access to their records, just like you and I have access to our records when we go to the doctor, right? I have every right to ask them what's in my file and to get a copy of that and to see it. That is a patient right. And our clients have those same rights, and that's a good thing that they have that same right. It scares a lot of therapists, though. So that's why I always frame it as we are also clients, and we want to be able to have that access to our records. That is a good thing in general for all professions. And it is something to consider when you're writing your notes. So one of the things I like about having a lot of templated statements in a system like ICANN Notes is that it takes a lot of the subjectivity out of things. So you wouldn't want your client, for example, let me rephrase this. One thing that's important when you're writing your notes, if you want to consider this, is just think like, would I say it this way if my client were literally looking over my shoulder and reading this? So it doesn't mean that you're hiding things from notes or that you're not writing things in notes just because maybe a client wouldn't be happy to see it. It just means that you're doing it in an objective way, that you're writing your notes objectively so that, basically so people aren't offended. So kind of thinking through that. Write in a timely manner. So I will tell you, I reviewed thousands of progress notes at this point in my life, and I can predict with almost 100% accuracy if someone has written their note in the last 2 days or not. Most therapists have a point in their life, or it's most of their career, where they are very behind in notes, or where they need to catch up on their notes at some point. And I will tell you, from an auditor's viewpoint, it is noticeable. So, however, I don't want you to feel ashamed about that, because it is so common, super common. It happens. It happens to almost everyone. So the key here is that you really want to have some kind of a notes schedule. So whenever I meet with therapists who are really behind in their paperwork, because this is one of the most common reasons that I consult with people, is, they're months behind on their paperwork and they need to catch up, right? They typically have like a little notepad that they've been using to write their notes, and they're like, oh, now I have to transfer all these into my EHR. And that is, it's one of the strategies people use that they think is really going to help them, because they're like, oh, well, I don't want to forget it, so I'll write it on here. But guess what? If you don't have that notepad and you don't have that option, you are much more likely to actually make it happen in your electronic health record. So it's really important to consider when you're thinking about, how many clients do I see in a week? How many clients do I see in a day? How do I schedule my day? When's the last time I see my client? When do I want to be home for the day? All of those things you want to consider notes as part of that. So if you see 20 clients in a week and it takes you 10 minutes to write a note, that's 200 minutes a week writing notes. Only writing notes, not doing other admin stuff, not answering emails, not following up with clients, not answering phone calls, all of that stuff. So you want to have a notes time specifically dedicated to notes. And that will help with getting your notes done more quickly, but it really impacts the quality. It'll make your notes much better. From that experience, I've recognized that therapists really overestimate their memory. So most of you could tell me, for all your current clients, if I said right now on the spot, give me a case summary, almost all of you could give me a good case summary of all of your clients right now. But can you tell me what happened September 10th versus September 17th of 2021? No, because none of us can remember that level of detail and week by week, right? So what happens when you get really behind is then you start noticing, oh, like, I thought I had these good notes, but now that it's been so long, I can't remember that. So don't overestimate your memory. Really just try to get the notes done in a quick time frame. And remember, if you ever, let's say you write your note, you sign it, you think you're done, and then you remember something later that was really important that you want to add in there, you always have that option. You can always go in there and edit the note. Part of the point of having an electronic record is that it tracks that stuff. So it's not shady in any way. It shows that, yeah, hey, I went in and did this note at this time. I signed it. Then I remembered I needed to add something. I went in on this day and I added it and I signed the note again. So you have that tracking system. And that's like the legal ethical part of it, is just that you're not faking it. You're not saying like, oh, this is how I wrote the note the first time. It's perfectly acceptable to go in and change your note. I'm not going to go on to this too much, but you also want to communicate contact you have with clients outside of sessions. So if you have a phone call with a parent, or if clients are talking about missing appointments, you just want to make sure you track those things in your notes as well. Really, the key is at the bottom there. If it's not written down, it didn't happen. Okay, I'm going to finish this last section and then we will dig into full-on Q&A, okay? So here's my biggest pro tip. Honestly, if you can only pick one or two things to remember from this webinar, this is one of them. Never write anything twice. Again, if you have that information on symptoms and their impairments and how it's impacting them, you have that in your intake document, you don't need to put that in your treatment plan. You can always write "see intake," right? So anytime you think, oh, I already wrote this somewhere, or oh, I have to copy and paste this, or oh, why am I putting this over here? Think of this rule: never write anything twice. Even for Medicare, which is like the most stringent insurance company, If you have it in there, you can always put, again, see intake note, see last progress note, whatever that is. You don't need to write anything twice. Try not to duplicate information like from your intake assessment, using a treatment plan template, which you already have that available to you, and using it just consistently. Same with a note planning template. And use collaboration whenever possible. So by this, I mean doing your notes, doing your treatment plans, doing your intakes with clients in session. And a lot of therapists don't like the idea of doing notes with clients in session, but treatment plans and intakes, there's no reason you can't do those with clients in session. It takes a little bit of practice. Yes, you have to be on your computer while you're doing it. And most people are used to it at this point. And that doesn't mean that you have to be a robot or you can't still connect with them. Sometimes it takes a little longer, and that's okay. Maybe your intakes are 2 sessions. That's totally fine. And then maybe you spend a whole session actually doing a treatment plan with a client. But using that collaborative process, for one, it's a very client-centered approach, especially with treatment planning, because that I find is one thing that a lot of therapists feel like it's this document they have to do after the client leaves. And there is nothing more clinical and important than actually making sure you and your client are on the same page with the treatment plan, right? So absolutely do that with them in session. There's no reason that you have to do that later. The idea is that clients complete a lot of the paperwork before session, but you complete your paperwork in session with clients. Again, even if you don't want to do your notes in session, treatment plans and intakes 100%, because trust me, it improves the quality of those documents, and it makes it so much easier for you to get them done. You could also consider using collaborative documentation, which is where you do write your notes with clients. There's a variety of ways you can do that. That's like a whole training literally in and of itself, so we won't dig into that, but it is something to consider, especially if you're someone who tends to really get behind in your notes or avoid your notes. Then considering actually doing at least some of the note in session can be very, very helpful. You can use your clients as accountability. So for example, I used to give my clients access to their notes. Logistically, I don't know how to do that in every single EHR, so we can talk about that, but it helped me know that my client was expecting me to write the note. So it was something I was constantly talking to them about, and that I didn't feel like they were my notes that I was hiding from clients. I felt like they always had access to them, and it just helped me feel like, oh, okay, like I need to get this note done because this person might ask for it. And then have clients complete other forms or other documents outside of session whenever possible. All right, so we're going to dive into some Q&A for the rest of our time. But I do want you to think, like actually kind of stop and think right now. How are you going to implement what we covered today? And I want you to know that you can take control of your notes. Okay, you have the system, you have all the tools that you need right now. You have everything you need to take control of your notes at this very moment. You do not need any other resource. You truly don't. You don't need anything else. You have it all. So you can start today. So continue updating your template as you go, right? Even if you don't want to sit there and do a bunch of work and spend an hour kind of looking through my interventions list and adding different things in, you can do it every time you start writing a note. Just add in add in another intervention into your interventions list there. Use the cheat sheets. Think about your schedule. So these are all kind of different ideas, like what is the one thing you want to take away and actually implement from this? If you're finding yourself constantly writing your notes at the end of the night, after you got home, after you put your kids to bed, while you're watching TV, because these are the stories I hear all the time, right? That's not something that you want as a sustainable part of your career, probably, right? So how can I look at my schedule and actually plan ahead for writing notes and think about how much time I actually need for writing notes? Because anytime you add on a new client, you're adding on another 5 to 10 minutes of writing your note into your weekly schedule. So really consider that. So I do believe your paperwork can improve your relationship with your clients. And as a result, you will have tangible examples of the change you help people create. You'll keep more clients because they're engaged, because you have those examples in your mind and are using them. And then you're able to grow your practice through more referrals. I want to end on this, especially as we get into Q&A, because this is such an important topic, and it's something that so many therapists feel a lot of shame around. They feel shame for not knowing how to write their notes. They feel shame for, they've actually been shamed by a supervisor for asking questions about how to write notes. They feel shame about being months behind in their paperwork. They feel shame about paying for an EHR that they're barely using. I see all of those things every single day, literally every single day that I work with clients. So I want you to remember that, shame corrodes. This is from Brene Brown. Shame corrodes the very part of us that believes we are capable of change. You absolutely are. It is not, notes do not have to be something that plague you for the rest of your life. And they do not have to be something that keeps you from enjoying your career otherwise. Okay. And I don't want, part of the reason I do all of this and talk about all this stuff is because I don't want therapists feeling shame about something, especially something that is so common and so many other therapists are feeling as well. So keep talking about notes, talk to your colleagues, your supervisees, talk about it at work, all of that. But let's dig into some questions now. So we have a good 15 minutes left for Q&A. I wanted to make sure we had lots of time there. I know I kind of breezed through a lot at the end, but let's see what questions you all have. Oh, and I'll put my contact info. Put my contact info up there if you want.
There. Great. We have quite a few questions, so I'm going to try to get through these. It's people, just great questions today, so it's fantastic. Layla says, I thought there was a recent change in Chapter 400 that stated we had to discuss the client's specific treatment goals in the note.
So that's a really specific, I don't know which Chapter 400 that could be. So for example, even with Medicare and Medicaid, even though those are federal entities, they are also implemented differently in different states. So when you get into really specific things like that, it's usually more of a county or state level requirement. Obviously, I'm not up on all counties and states and all of their different requirements. So it could be part of it. Based on how you described it, it sounds like a Medicaid type thing, or a Medicare type thing. So of that, I'm not aware, but it sounds like it's also very specific to wherever you're located or whatever entity you're working with.
Okay. Then next we have, I've had Medicaid specifically ask us, and this is from Nanette, I've had Medicaid specifically ask us to have the goal on the top of each note, and they want to see what was the patient's response to intervention. I've always tried to include that. What are your thoughts on that?
Yeah. So if that's the feedback you get, excuse me, from like an audit, or again, if you have outside entities that are dictating part of what needs to be in your notes, then you include those things. So just put the goals up there. It's fairly easy to do that. It's copy and paste. And then if you want to just have like a response section. Within ICANN notes, I would probably, in that example, I would do the interventions first, and then I would just do the response as part of that verbal content section.
Excellent. All right. Michelle asks, what are the main points to address in notes when working with kids?
And the exact same things. So you're talking about basically what did you discuss in the session? What are the interventions you provided? How did the client present? And then what's your plan moving forward? And if there's insurance involved, you want to make sure you specifically address that ongoing progress and ongoing need for therapy. But same thing, I think the only difference with kids is that sometimes you use interventions that sound less clinical. And I think that's what worries people, because like maybe I'm playing a game with a kid, for example. So anytime you're concerned about that, just explain why you did the intervention. So you might actually have in your interventions list, for example, like played trouble, right, for to help with practicing social skills. So you can, again, just make that part of your templated statements that you have in there. And if you kind of vary games, but a lot of times we play games with kids in order to practice social skills. So, played a game in order to practice social skills. So your intervention is just a little bit longer because you're showing the purpose of it.
Great. And Elizabeth said, if progress is nil, do we need to explain why and what we will do?
Not so. This is, again, it's it depends, right? Which is always my answer. If it's a one-off, then no. It's perfectly fine to just say client reported no progress this week. But that's where, do you want to say that 10 weeks in a row? No. So you just want to pay attention to that. And if you're continuing to show that there's no progress, then then for one, it becomes an issue for insurance, but more importantly, then that's an actual clinical issue, right? If someone says they're literally making no progress, and that kind of goes back to like my example of when my very depressed client literally said to me, like, I feel like this isn't going anywhere. I'm not making any progress. And then I was able to go back and actually show that was not the case. So it is something I would say more importantly, it's an actual clinical issue to talk with people about. But absolutely, people fall behind and have weeks where they don't make progress. And that's okay every once in a while to put that in there.
Great feedback. There was another question Erica had asked about, what about notes that pertain to pediatrics? An example is if you do CBT. I think you said kind of the same thing, right?
Yeah.
Excellent. And then Ivy said, can you give an example of what a treatment plan actually is, and does the client need to sign off and agree with the treatment plan? So we are in June going to hold one on treatment plan. So we're gonna, because I think that could take up
Perfect.
60 to 90 minutes of time.
Yeah, it's
So
its own training for sure.
absolutely. Then Cheryl said sometimes a family member will want to meet without the patient present. How do you document that in a progress note without making the progress note all about the non-identified patient?
Yes. So, and I think that's the key, is to just think, what's the purpose of this meeting, right? So let's say it's a parent of a child. When you're meeting with a parent, now I do understand that in practice sometimes this actually does occur, but the point of the meeting is to help the child, right? Does that mean that sometimes we end up talking to a parent about for example, their relationship struggles, right? Or things that are stressing them out and how it's impacting their parenting? Yes. But that last part of my phrase is the key to remember, how it's impacting their parenting. So it can be useful to talk with, for example, a parent about what to do when you're stressed out so that you don't react in a certain way to the child when they do X, Y, and Z. And this is where, again, it's a gray area, right? So you may do that every once in a while, and it's really helpful. And obviously that's going to help the treatment. And obviously anytime you help a parent with parenting, or you help, maybe it's like I worked with, a woman who had a severe chronic mental illness and lived with her sister, right? And so sometimes I would help the sister, in how to deal with helping the client. But then if it's getting into more regular talks, then that's where, they may be part of your recommendation, is like, actually it might be really helpful for you to have therapy as well, right? So I think that's the balance, is like, is it getting into, you're doing therapy with that person for their own issues, or are you helping them manage certain issues in order to support the client? So always thinking about, like, how is this helping the client? Just kind of sometimes it's helpful to just have those questions in your mind when you're writing specific notes. How is this helping the client?
Great. And then Jill asked, what are the primary reasons for clinicians getting behind in notes?
Yeah. There are quite a few. The big ones are just being concerned that you're not writing them the right way. And so you either avoid them or sit there and question yourself, and it takes so long to write the note that then it becomes a task that you then want to avoid. Or just it's physically impossible to get 20 notes done if you're spending half an hour on each note, right? And then you also have 20 hours that you're seeing clients, and then you also have other stuff, and then you might also have a personal life. So so sometimes it's, not planning ahead and just taking too much time on the note in itself. Other things that I see a lot are you might, so this is something I hear from a lot of therapists. You probably have certain clients that you're up on all the time. Their documentation is always on point, and other clients that you avoid. And so it might be an issue of looking at why that is. Is that because you feel less confident with that client? Is that because you are experiencing like some countertransference around that client, and it's more emotionally exhausting to go in and do that note? I hear this a lot from people who work with trauma, that like sitting down and doing the note is like revisiting this traumatic session that you experienced with someone. So sometimes there's an emotional component to look at as well. Sometimes it's just time management, right? So like I have ADHD. I have enough time in the day to do a lot of things that I expect to get done. I don't always manage it well, and so sometimes it is as basic as that. Or just not even thinking through how much time do I actually need if I see 20 clients in a week. How much time do I need to plan in my week to have for notes on top of everything else? Those are really the main reasons. There are other things like having ADHD, right? So sometimes being on medication can help with something like that, or learning strategies specific to managing, like a mental health problem that one of us might have. I also see a lot of people who either have chronic pain or had some kind of a surgery or something happen, or something traumatic, like their mother passed away. And then they're meeting with me because they're behind in their notes. And here's what I will say about getting behind in your notes. It's your red flag. It's your first red flag that's going to pop up. For example, like if you have something traumatic happen in your own life, you're probably like, maybe you'll stop seeing your clients for a couple weeks, but the first thing you're going to do is start seeing your clients again. Then maybe you're going to start like answering emails and replying to other people again. Then you're going to start doing your paperwork. The paperwork is always going to come last. And on the flip side, if you're getting burnt out, for example, probably the first thing you're going to stop doing is your paperwork. You're going to stop writing notes. You're going to stop staying on top of treatment plans and intakes, but you're going to stop seeing clients as the absolute last resort, right? That's the thing as therapists, we're always going to prioritize first. So it can be helpful if I get behind on my notes, instead of beating yourself up, stop and think what's going on. And if you're a supervisor, it's a very important question to ask someone. It's not just because they're not managing their time well, or need specific strategies. That may be part of it. But the first question to ask is, why is this happening? What's going on? Because it's a red flag that there's something more that needs to be addressed.
Great. That's great. I have and we're not going to have time for all the questions. Unfortunately, we have a lot of questions, and it's really good feedback as well. But Christiana asked, if we're getting paid for a 60-minute session, can we ethically end it after 50 to 55 minutes to do the note?
Yes. And the thing is, if you're looking at like billing codes, it's really 53 minutes plus. So that 908, what is it, 90837? Mm-hmm. It's 53 minutes plus. So anything over 53 minutes, then you're using the same code, whether it's 53 minutes or 60 or 65. So you just typically, if you want to like a rule of thumb, it's face-to-face time. So you're going to use the billing code that's based on the amount of time you were face-to-face with the client. If you don't use insurance, it's perfectly acceptable to say to people, I end my sessions at this time because I want time to do, all the other things that relate to your treatment, which is notes, which is case conceptualization, which might be consulting, all that other stuff. That is something you want to actually calculate as part of your fee, because the face-to-face time is only part of the work we do with clients.
And then, so I think we just have like one or two more, but I wanted to bring this question forward because this person is from Kenya. So thank you for joining us from there. It says,
Yay!
yeah, other than simplified progress notes, does the therapist have to make any other records of what transpired in the therapy session?
Oh, that's a good question. Yeah. Again, that depends on your, state and country and profession and all of that. It all impacts those rules. But in general, you do want to have some type of intake that highlights why the person has sought out therapy and what they need. And then a treatment plan, which could actually be very basic, that highlights what you plan to do to help the person. And then the notes are what you've been doing. Now, like here in the States, you might need other documents like specific consent forms, and we have HIPAA documents, like you want to have give people notice of privacy practices. There's all these other things that you could potentially need. Telehealth consent forms, all that. But in general, you want to show that you know why someone is there, what it is they want to get out of therapy, and then you want to show that you have a plan to actually help them, that you're the best person to help them do it. And then you're showing what it is you're actually doing in treatment ongoing.
Fantastic. And I think we have just a couple questions about Notes there. Yes, Notes is a great system to do your notes in. We're very popular among therapists and multiple other disciplines. In behavioral health, we're behavioral health only. And so I think that sets us apart from a lot of EMRs. We will have a webinar on treatment plans coming up. So we will put that out. Hopefully when we send you some things out, we'll have that set up. And the last question I think we'll get on is from Ivy. Is it true that insurance companies do not accept interventions provided, such as emotional support, validated and normalized feelings?
Awesome. This is a good question to end on. So I have something I call the grandma rule when you're thinking about insurance. And I will say it's pretty much Medicare and Medicaid that really are the ones that are sticklers on this. Private insurance, not so much. But you want to think, what did I have to go to grad school to learn how to do? Those are the interventions you want to put in your progress notes. So for example, if I talk to my grandmother, I have a good relationship with my grandmother, I expect her to actively listen to me. I expect her to have some empathy. I expect to have rapport with her. Those are all things that are kind of inherent in any relational process that you don't need to include in your note as an intervention. So empathic listening, active listening, building rapport. Forget what other one I said earlier, but those are all things that are just inherent to the therapy process, right? So we all have friends who are not therapists who are really good to talk to, who do all of those things. So think about, okay, what did I actually learn in graduate school? Those are the interventions you want to put in your note. Those are what we call like the quote unquote active interventions. If you've heard people talk about active versus passive, but that's a good way to kind of think about it. Like, could I just talk to my grandmother and get this experience? Well, then that's probably not something insurance wants to pay for, right? They want to see that you're a trained professional offering a service that requires training. It doesn't mean that those things aren't useful. Like, those things are absolutely necessary for therapy. So I'm not saying that. But they're just kind of understood and inherent in the process.
All right. Well, thank you so much, Dr. McCaffrey, for being with us
Yes.
today. I don't know if you've been looking at the chat, but the responses have been fabulous, and so many people are very grateful, and many people have stated this has been incredibly helpful to them. So thank you so much for joining us today.
Awesome. Yay. I'm so excited. Thank you all so much for your great questions. And and your chat and sharing all of these issues. Because again, I know it is scary to talk about and to admit often. So I really appreciate that.
Thank you so much. Everyone have a wonderful day. Thank you.
All right, bye.